Thanks for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. First, Africa is already being hit hard as remittances dry up amidst the coronavirus pandemic. That's seen Somalia's state revenue plummet by 40%. The World Bank fears sub-Saharan Africa could face a $37 billion loss of the payments this year. Also, in DR Congo, there are concerns that the coronavirus containment measures could put vulnerable women at particular risk. Cases of domestic violence in the country have spiked over the past few weeks. And as Africa competes in the global rush to source the medical and safety kit it needs to contain the spread of coronavirus, the continent's universities have ramped up their labs and their innovation to find regional solutions for their communities. But first, remittances are crucial to Africa's economic growth. Money sent back by citizens living abroad support communities that receive them. They may send kids to school, help feed families, or fund more ambitious projects. Now, the World Bank reckons that the coronavirus crisis could see the region lose around $37 billion of the payments this year. France 24's business editor, Kate Moody, has more.
In low and middle income countries, more money comes in through remittances than from foreign direct investment or international development aid. Last year, immigrant workers sent a record $554 billion to their families back home. This year, the World Bank warns that could drop by as much as 20%, the sharpest decline in recent history, because those workers are at a bigger risk of losing their jobs or seeing incomes cut during the economic crisis brought on by the pandemic. For comparison, remittances dropped by around 5% during the financial crisis a decade ago. Many families depend on remittances to stave off poverty or food shortages and to pay for healthcare and children's education. All that could be at risk. All regions are expected to see a drop in remittance cash flow. The biggest drop is predicted in Europe and Central Asia. Sub-Saharan Africa could lose out on some $37 billion, around a 23% drop. The cost of sending money to the region is also a third more expensive than the global average. The World Bank says it's working with countries to reduce that cost and keep remittance channels open. We've heard warnings that millions of people could fall into or be stuck deeper into poverty as a result of the pandemic. This latest warning from the World Bank, a reminder that a crucial financial lifeline could be weakened and millions more affected.
Well, in DR Congo, there are concerns that the coronavirus containment measures could put vulnerable women at particular risk. Cases of domestic violence in the country have spiked over the past few weeks. Our correspondents report.
Every morning for the past month has been a race against time for Mama Tete. She gets up before 6 and there's no shortage of housework to be done.
I have to clean up the living room, tidy up the kitchen, and at 8 o'clock I wake up the children. They're at home all day. Schools are closed because of the lockdown.
Like most women in the DRC, Mama Tete does all the chores at home. Now she also takes care of her 5 children full-time. An extra workload she's been struggling to cope with. She says she's unable to juggle homeschooling, house chores and her job as a door-to-door saleswoman.
During the state of emergency, it's become impossible to work now. I can't leave the house, I can't sell, we're stuck at home.
For some women, being confined can also turn into a nightmare. Sylvie, who asked to remain anonymous, has been a victim of domestic violence for 10 years. Since a state of emergency was declared last month, the situation has gotten worse. She's now trapped with her abuser all day long.
Before the lockdown, at least he could leave the house. But now he's always home. So he beats me and he rapes me more often. His only distraction is my body. If I refuse, he threatens me with a machete.
In the DRC, feminist groups and some politicians have raised alarm about the plight of women during the state of emergency.
Authorities have declared a state of public health emergency, but laws continue to apply. It doesn't give criminals free rein to rape or hit women. Judges must not trivialize acts of violence, even during a state of emergency.
Despite concerns from organisations, the Congolese government is considering extending the state of emergency. A vote in Parliament is expected in the next few days.
South Africa plans on deploying 73,000 extra troops to help enforce its coronavirus lockdown. President Cyril Ramaphosa has also announced a $26 billion economic relief package, which is about 10% of the country's GDP, in order to help businesses and workers during the pandemic. Well, despite the efforts to officially support South Africans during the crisis, those who work and live informally are still particularly vulnerable. Nicolas Chemin has more.
The South Africans who are destroying shacks work for the private security firm called the Red Ants. It specialises in evicting people from land that is illegally occupied. The Red Ants worked with the police for this operation near Johannesburg. They even fired rubber bullets at angry residents. But the government had said that during the current 5-week lockdown, evictions would not be allowed. Locals are furious.
They said we must be locked up, and now here they come. They said we mustn't be in groups, and now here we come. We're running up and down, up and down. We're running, we don't know where to go. Our children doesn't have any place to stay. We also don't have places to stay. Look what they've done to my house.
The authorities said there had been an increase in illegal land occupation since the lockdown began on the 27th of March. But residents said they had been living here for 2 years.
I was sitting peacefully until they came and they bulldozed the place down while I was still inside. What happened if they killed me or I died? Then what then? I can't do anything, so it was locked down inside. Now I'm locked down outside. I have nowhere to go.
At the start of the lockdown, the government had announced a major plan to relocate people from overcrowded informal settlements. The aim was to limit the spread of COVID-19. But nearly 4 weeks later, the plan is yet to be implemented.
Access to medical kit is key to the continent's efforts to tackle the coronavirus pandemic. From masks to respirators to personal protective equipment known as PPE, the continent's now competing with other regions in the world for the tools it needs to equip medical staff and treat and test patients. Engineers and students at African universities have been quick to rally to the call for solutions and do what they can to literally come up with the goods. I spoke to Dr. Ahmed Shaikh from the Regent Business School and asked whether, compared to China, the US or Europe, there's anything different about the difficulties Africa is facing in getting the coronavirus kit it needs.
We had the first infections recorded from a group of South Africans who visited Italy somewhere around the first week of March. So I think when we started picking up infections in many African countries, by then, the global supply chains were quite severely disrupted, starting sometime in January, probably, with China picking up infections even in December. So I think that when the infection rate sort of started picking up in Africa, by then global supply chains were disrupted or closed down, and we had no real opportunities for countries in Africa to acquire any significant quantities of PPEs. By then, borders had closed, lockdowns were in place, etc. So this probably is the difference that we've had in Africa as compared to the shortage of PPEs in Europe and America and the East.
And so what kind of solutions has the continent seen, or what's been offered to try and make up the shortfall in the kit that they need?
Thank you very much. I think there's an interesting flurry of innovation, if you like, across South Africa and many other African countries in our perspective. From my own institution, which is part of the Honoris Network, we've had to rapidly pivot our research innovation agendas, if you like, or repurpose it to be able to respond to this global pandemic and its impact on African countries. If you like, it's our own version of doing triage, as people say in the healthcare fraternity. So we've had to say, look, this is what teaching and learning must do, and this is how our research and innovation agendas has to be re-engineered or repurposed. So across the Honoris platform in many universities on the continent, we've had the opportunity of bringing together staff, faculty, students, our partners and collaborators to be able to rapidly build simple, inexpensive and scalable solutions for PPE across Africa. For example, in my own institution, Regent Business School in South Africa, we've had the benefit of access to 3D printing technology in our maker spaces called the iLead Lab, and we've been able to manufacture 3D print splash protection masks, face shields, and we've been distributing these free to frontline healthcare workers and first responders across all the major cities in South Africa. And we've also sent these to Southern African countries neighboring South Africa. So we've got maker spaces across all our learning centers in the major cities of South Africa. And that's one solution we have had as a university within the honoris network. Just to give you another example, in North Africa, our partner universities in Tunisia in particular, they put together a team of scientists, doctors, and engineers, and they've prototyped and built a respirator to aid breathing of COVID-19 infected patients. And they've done this with a very simple, open source, scalable solution, and they've made it available widely to other industries and other institutions to build. If I had to give you a quick third example, in Morocco, our partner institutions in Casablanca, some of the leading engineering universities are part of our network, and they've had participated in a hackathon for the whole of Morocco. And some of our students, faculty, had come up with some interesting solutions. For example, our students in Morocco had built a drone that was able to deliver testing kits to rural areas across Morocco, and they're able to get back these drone samples of testing kits, pass it through a disinfected location, and then into a testing center. Another example in Morocco is we've built some smartphone technology that doctors and healthcare workers can use to track COVID-19 patients. So I think there's been a flurry of innovations within our own network of honoris and certainly across many universities in South Africa and Africa. And I think that these are the kinds of repurposed research agendas that our sector, tertiary education, has been able to engage with, and we've been able to respond to the global pandemic and, of course, the shortage of PPEs.
Well, bearing that in mind, do you think that that suggests that universities will perhaps going forward play more of a role in terms of driving innovation on the continent, and that they'll get the support they need to be able to do so?
I certainly think so. I think there's, quite frankly, a renewed vigor. There's a new energy at universities and our own institutions. And we've always maintained this notion that universities are hubs for social innovation, social entrepreneurship, teaching and learning and research, not just for research's sake, but for social impact in communities. And I think what COVID-19 has done is presented, if you like, a golden opportunity in the midst of a terrible crisis for universities to rethink and reimagine what the research and innovation budgets and agendas are needing to be. So I'm really hopeful.
Dr. Ahmed Shaikh there speaking to me a little earlier on. Well, that's it for Eye on Africa. Thanks for joining us. Do so again if you can. Take care.